All right, let's get right into it. We're going to tackle a super high-yield topic for your ATI nursing exam, pediatric GI disorders. My goal here is to cut through all the fluff and give you exactly what you need to know to spot these conditions, figure out what's going on, and know what to do next. Let's do this.
Okay, so you see a question like this on your exam. This is classic ATI stuff, right? They give you a clinical puzzle, and your job, your only job, is to spot those key clues fast. And that's exactly what we're going to break down, how to see these signs and know what they mean instantly.
Look, acing the ATI is all about pattern recognition. Seriously. So that's where we're going to start. We're going to put these key assessment findings side by side so you can see exactly how to tell one GI disorder from another. Let's dig in. Okay, this is so important. The type of vomiting is like a giant flashing sign pointing you to the right diagnosis. Think about it. If you see projectile vomiting, like across the room forceful, that just screams pyloric stenosis. The stomach is literally fighting to get stuff past a blocked exit. Now, spitting up, even if it's forceful, especially with an irritable baby arching their back, that's probably GERD. But, and this is a big one, if you see green, bile-stained vomit, whoa, stop right there. That's a huge red flag for a blockage after the stomach, something serious like Hirschsprung's.
All right, let's talk about what's coming out the other end, because believe me, the stool gives you absolutely critical clues. If you ever hear the phrase red currant jelly stool, bam, your brain should immediately go to intussusception. It's just one of those classic textbook signs. And what about foul-smelling, ribbon-like stool? That's pointing you straight to Hirschsprung's. Then, of course, you've got your watery or bloody diarrhea, which makes you think, okay, we're probably dealing with an infection here. You have got to know these cold for your exam.
And the last big clue is what you can actually feel. When you palpate that little abdomen, you're looking for one of two things. If you feel a hard little mass in the right upper quadrant that feels kind of like an olive, that's your money sign for pyloric stenosis. But if you feel a mass that's more elongated, like a sausage, that's intussusception. Knowing the difference between an olive and a sausage here is, well, it's a game changer on the ATI. Okay, so we've got our clues, right? Vomiting, stool, what we can feel. Now let's put it all together and talk about the actual diagnoses. We'll kick things off with some common infections and then get into the big structural problems you'll definitely see on the test.
So first up, let's talk rotavirus. This thing is everywhere. It's the #1 cause of diarrhea in kids under 5, and man, does it lead to dehydration fast. And because it's spread fecal-oral and only takes about 48 hours to show up, you can see how it just rips through daycares and homes. So when you're thinking rotavirus, you're thinking about this whole package of symptoms. You get a fever, some vomiting for a couple of days, but that watery diarrhea, that can stick around for a solid week. And that's the key right there. Your #1 job as the nurse is going to be all about hydration. You're on high alert for dehydration from day one. And here we have cleft lip and palate. These are structural issues that happen when things don't quite fuse together correctly during pregnancy. As soon as a baby is born with this, your nursing brain should be firing on 2 cylinders, feeding and aspiration. How are we going to get nutrition into this baby safely? It's all about using special bottles and techniques until they're ready for surgery. All right, another really big structural problem, Hirschsprung's disease. The easiest way to think about it is like part of the colon's electrical wiring is missing. There are no nerve cells to tell it to squeeze and push things along. So what happens? Everything just stops. You get a massive traffic jam, a total blockage, and it shows up right from birth. So for a newborn, this is the red flag. If that baby doesn't pass their first stool, that meconium, within the first day or two, that is a huge warning sign. You pair that with the bile-stained vomit we talked about and a big, tight, distended belly, and boom, Hirschsprung's disease should be screaming at you from the top of your list. Okay, so knowing what it is great, but the ATI wants to know what you're going to do about it. So now let's shift gears and talk about your priority nursing actions. This is where the rubber meets the road. So for Hirschsprung's, the fix is surgery. They go in and take out that section of bowel that doesn't work. Afterwards, your job is all about post-op care. And what do we always do first? ABCs. Check their breathing, make sure their airway is clear. Then you manage their pain. Keep a close eye on that surgical site for any issues. And listen for those first beautiful bowel sounds that tell you things are starting to work again. Sometimes they'll have a temporary ostomy, so you'll need to know how to care for that too. Now listen up, because this is life or death stuff. The absolute worst-case scenario for a kid with Hirschsprung's is a complication called enterocolitis. It's a nasty inflammation of the bowel that can happen because of that backup, and it can go from looks sick to full-blown sepsis and shock fast. You have to be watching for this.
So if you even think enterocolitis might be happening, you need to act immediately. No waiting around. That means you're in there doing vitals constantly, looking for fever or low blood pressure. You're measuring their belly girth with a tape measure, and you mark the spot so you're consistent to see if it's getting bigger. And you're getting ready for fluids, electrolytes, maybe even blood, and getting those IV antibiotics going. Your speed here can literally save their life.
Okay, let's switch to something you'll see all the time, GERD. And with GERD, one of your biggest jobs is going to be parent education. You're their coach. So you'll teach them about smaller, more frequent meals, maybe thickening the formula with a little rice cereal, avoiding foods that make it worse, keeping the baby upright for a bit after they eat. But, and please drill this into their heads, even though you prop them up after a meal, when it's time for sleep, they must be on their back. Always. Back to sleep every time to prevent SIDS. All right, let's lock this all in. We're going to do a quick rapid-fire review. These are the must-know, non-negotiable associations you need to have down cold for your exam. Ready?
Pyloric stenosis. You're thinking olive-shaped mass. Done.
Intussusception, that's your sausage-shaped mass plus the red currant jelly stool. Those two go together.
And Hirschsprung's? The classic sign in a newborn is no meconium in the first 48 hours. That means obstruction. So let's end with this. Your patient has terrible diarrhea. Their cap refill is slow, more than 4 seconds. Their heart is racing. Their fontanelle is sunken in. You know what this is. It's severe dehydration. It's a crisis. So the final question is this. What is the very first thing you do? Your immediate life-saving action. Because figuring that out, that's not just how you pass the test. That's how you become a great nurse.